this is one of my favorite questions to ask doctors. Okay. I have been touched by this topic personally. Um, can TMS treat autism?
Oh, I say absolutely yes. Now, people need
Oh,
to understand it is not FDA cleared for autistic spectrum disorder.
right.
Um, we haven't talked about this, but in addition to the regular TMS, I guess you could call it that. I do MERT, magnetic resonance therapy, and I don't know if you know
Okay.
a lot about that. So the EEG guided TMS.
Uh-huh.
And I have found it amazing for people on the spectrum, as well as other things. So the way MERT works or ETMS
There you
is
go.
it's you do an EEG of the brain before you
Hmm.
start, and rather
Hmm.
than like we have a set fixed protocol that we use for OCD, depression,
Uh-huh.
anxiety, right?
Uh-huh.
Cessation. Like this protocol is actually driven by their brain. So it goes off to a lab, right? We're using the same FDA cleared device that we use for the regular TMS, same device, but where we treat and the Pulse protocol is based on their brain. So we think, even though we don't think of it as diagnostically driven, there are specific diagnoses. And when you hear them, they're more whole brain issues. So things
Okay.
like, right, autism, things like uh, cognitive decline, PTSD,
Yeah.
right? Those
Oh,
are, we also do really well with tinnitus and we do well with TBI. Um, but when you're treating PTSD, autism, right, like the cognitive dementias, right, to me, that's the way to go. And that is TMS technology. Um, I think we just need more research. They are doing some big research trials now at a couple sites for the EEG guided TMS for PTSD. I think that is going to be an indication that comes soon.
mm-hmm. Now with that, are you treating different locations?
Right now we only have the MERT system in Manhattan Beach.
Okay.
And when we, and I'm not a child molesting psychiatrist, so it's hard. We've treated some that you can treat down to the age of 3, right? When we're treating, I've
Uh-huh.
treated the
I've
youngest
seen it.
is 6. Yeah.
I've seen
And
a 4-year-old treated,
okay.
and it was
How
amazing.
how they do?
Best thing I've ever seen. The reason why this is my favorite question,
Okay.
um, I've seen it happen.
Yeah. Me too.
And not only that, I'll try and keep it short because it's a long story,
Oh,
but my nephew
okay.
was treated for autism by the same doctor that treated me, and
Okay.
I didn't know it at the time. But when I went through my treatment, he had already treated my nephew.
Oh, wow.
And I I had kicked that doctor out of my office because he said that he could treat autism, and the same reasons why I wasn't going to get in the chair, right? I kicked him right out of my office because he told me he could treat autism, and little did I know at that time he had already treated my nephew and
Wow.
helped him out so much. It's not even funny.
Yeah. No, it's incredible. So the hardest thing with the children is the parents need to help them practice like for the
Yeah.
EEG. We have a, we can do like a day pro model versus the heavier EEG, and it's a little,
Mhm.
make it a little bit easier, but that is some work, right? And then, with those children, when change is hard and movement's hard, and so it's a big commitment to get them into the office every day.
Yeah.
They do not have to sit in the chair, which is the cool thing. Like they can play
Yes.
around.
Yes,
They have
yes.
exercise, right? We have a little bell that goes off, and then they can come and we hold the coil and we count down for them. And they actually
Ah,
quite well over time. But I have seen kids who weren't sleeping. Their parents had not had like a night to sleep through in 8 years,
yes.
and then
Yes.
you start sleeping,
The
right?
families, the benefits to the families, the whole situation to me is
Yeah,
the most beautiful thing I've ever seen or been a part of, right?
yeah,
So special. You're helping the entire family.
absolutely.
And it's such a beautiful experience to be a part of, right?
Yeah, yeah. No, it's incredible. And those are the main things. The sleep gets better, their social reciprocity definitely gets better. And we've had people that have lost speech, had speech as children, lost it around 3, 4, and
Uh-huh.
regain speech with
Uh-huh.
it's incredible. Now they do need to come, it's a little like we sort of the routine is you really try to pick, like, I mean, every summer they're coming for a stint of time,
Yeah.
maybe 4 weeks, because obviously they're developing and growing and you need to keep
Mhm.
going. And so you want the families to understand that expectation. It's not a one and done, right?
No, yeah.
But
Super
it's
important on that too.
really incredible. Yeah. Yeah. Was astounded with the outcomes.
Thank you for all of that.
You are welcome.
I've asked several doctors that question on camera, and you just blew that one out of the water. I really appreciate that. And I
So,
love how you personally lit up while answering it, which
yeah.
goes just to show the human in you, right?
Well, thank you.
Which again, not to discredit all the other doctors that I've talked to, but it's so special to see. It
Oh,
really is very special to see, and I thank you from
yeah.
the bottom of my heart. I
Oh,
mean, you already know what you're doing for people's lives, but it's so nice to hear it. And just the
feel
care that you have for it.
so lucky. Yeah. Like, I mean, I feel so lucky every day with what I get to do. I mean, the way
Right?
it's crazy, right? I am so honored. People like let me in their lives and they
Yes.
like trust me and I really have an impact. And I'm like, I can't imagine doing anything else. And once again, I know so many people have jobs, right, that they go to every day.
Mhm.
It's like, I'm just, like, so happy with what I do every day. Like, it's crazy to me. I mean, right, there's things about the job you don't like, but I mean, overall, like, I'm just yeah, it's so
I
meaningful to me.
I find myself sometimes being asked, how was work today? And I'm like, you know what? I worked my butt off today.
Yeah.
And as it's coming out of my mouth, I have to stop myself because I'm like, no, I didn't. No, I didn't.
Yeah,
Did I really work? It's not like I was up on a roof,
right.
I wasn't digging a ditch, you
Yeah,
know. I
yeah,
wasn't, and so I laugh about that from time to time. I really do.
I know, I know.
Hey guys, I know you like that video. Do yourself a favor. Click on this one right here. More content about TMS, the benefits of TMS, and how we're going to change the world with TMS. Did you click on it? Click on that one right there.